Harriet Hoff. I'm professor of anesthesiology and biomedical engineering at the University of Utah. My research focuses on actions anesthesiologists can take to reduce healthcare-associated infections. This work has suddenly become trendy during the COVID-19 pandemic. I'm here today to talk about infection control in the context of dual infection risks to patients as well as to healthcare professionals. Our fifth question is, how has the COVID-19 pandemic changed practice related to the use of filters? Well, the COVID-19 pandemic clearly increased awareness of filters and their capacity to prevent machine contamination and protect both patients and healthcare workers. The COVID-19 pandemic also highlighted gaps in understanding and confusion amongst anesthesiology professionals about what filters are and which filters and configurations are best for various situations. I highly recommend the Anesthesia Patient Safety Foundation Frequently Asked Questions website on filters as a source of more information on filters beyond that discussed in this video series. As a result of the COVID-19 pandemic, use of at least one filter in the anesthesia circuit is now close to universal practice, and use of two filters has become much more common. When you're taking care of a patient with confirmed or suspected infection with the SARS-CoV-2 virus, two filters are strongly recommended to ensure that you protect the machine from the patient and the patient from the machine. An airway-mounted filter that incorporates an HME device is recommended as one of the filters for anesthetic care. This is particularly important if you're concerned about protecting healthcare workers from aerosols when the patient coughs during intubation or extubation. When anesthesia machines are used as ventilators for patients with COVID-19 disease, the recommended configuration is two machine end filters, one on the inspiratory limb and one on the expiratory limb, which again could be a dual chambered filter or two separate filters. From an infection control professional's perspective, a side benefit of the COVID-19 pandemic has been increased awareness of filters and their value in protecting both the patient and the machine. And I am hopeful that in the future, this will reduce cross-contamination both of patients and of healthcare workers. COVID-19 has certainly changed anesthesia practice in many ways. One of them is the universal use of filters. Thanks for watching. In the next video, we'll talk about long-term impacts of COVID-19 on anesthesia practice.